Hi, my name is Melissa Dalton and my campaign proposal is on folic acid. The selected audience that I'm using are women that are planning a pregnancy. The target behavior is to get women that are planning a pregnancy to start taking 400 milligrams of folic acid at least 6 months prior to a planned pregnancy. This will help prevent neural tube defects such as anencephaly and spina bifida. My marketing strategy is to explain to women that not only taking folic acid will reduce the risk of a neural tube defect, but also help improve their health. It helps prevent strokes, heart disease, certain cancers, hair, skin, nails, memory. Also helps with sickle cell anemia and deficiency if you have a deficiency of vitamin B12. This is also can be prescribed by your primary physician, or you can buy it over the counter. This is Woman's One a Day. It can be found in this, and it's a gummy, which is what I usually take, and it has 400 milligrams of folic acid. Not only that you can get a prescribed medication, there's also folic acid in certain foods like beans, spinach, asparagus, broccoli, citrus fruits, but just eating these foods is not enough to ensure that women are getting enough folic acid a day. So please be sure that you are taking the correct amount of medication. If you do not have insurance or are not able to afford to purchase the medication, you can go to your local Department of Human Health and Resources to get the assistance you need to start on the medication, or you can talk to your primary care physician to see how they can help and assist you. Maybe they may provide you a bottle for free or a free trial. This is a picture of my daughter in 1995. We found out at 4 months that she had a neural tube defect, anencephaly. She only lived for 14 hours. We were told she can live for hours, minutes, or days. We were so happy and thankful that she lived for 14 hours that we got to spend that much time with her. But before my pregnancy, my doctor never advised me of the risk if I did not take folic acid before getting pregnant. What we did not know until after we found out about our daughter is that after my false positive pregnancies, my body did not have enough folic acid in order for our daughter to develop in the first trimester, which is when their brain and everything develops at that time. Before we planned our second child, we talked to the doctor and he advised to take folic acid for at least 6 months to a year. The medication was prescribed by my doctor and I had to take more than just 400 milligrams. I had to take at least 1,000 milligrams a day because of having a baby with a neural tube defect. This is my boys today. I have 2 now. Very healthy. The oldest will be 20 next week and my youngest is 16. The medication also helps with if women are overweight, have diabetes, have a hemoglobin disorder, and takes anti-seizure medication. They are also required to take a higher dosage of at least 1,000 milligrams a day in order to help neural tube defect. Please talk to someone who has or had a baby with a neural tube defect. They can talk to you about what they went through of losing a baby with anencephaly, carrying your baby for months and then not being able to see them grow, or someone that is taking care of a baby with spina bifida who has medical bills, doctor's appointments, and just seeing and hearing what the child goes through. Only about 40% of women take folic acid, and we need to increase this by at least 50%. We also need to decrease the amount of babies that are born with a neural tube defect, which is over 3,000 babies a year. If you are wanting to start a family, please talk to your primary care physician about reducing the risk of having a baby with a neural tube defect before planning a pregnancy.